So what do you do now that your doctor has diagnosed you with hip osteoarthritis? Are you looking for something other than the medications and the surgeries and procedures that your doctor's offering? Well, watch this video to learn a natural solution to hip osteoarthritis, and that's with exercise. Could you do me a favor and subscribe to my channel and hit that bell so you're notified of all of my content? I put out content on physical therapy, Pilates, health and wellness, and would love your support of my channel. Thanks a lot. So what exercises should I do now that I know I have hip osteoarthritis? Well, watch this video to learn a couple stretches to do and a few exercises to do as well to keep that hip mobile and strong as possible. I've helped hundreds and hundreds of patients with this condition over my 20+ year career as a physical therapist, and I look forward to helping you as well. So the first thing we're going to do are 3 stretches, and then we're going to do 3 exercises. So the first 3 stretches, and the one that I think is the most important, is the Piriformis Stretch. So Cheryl, go ahead and bend your one leg up, both legs up, and cross one leg over the other, whichever one's your tight one. So for her, she's picking her right one. Now in that position, she's crossed her right leg over her left leg. Now I want you to reach through and grab on behind your left thigh. Yeah, and you're pulling with both hands towards the chest. Now what I want you to do is take some deep breaths. Inhale and exhale. And we're gonna hold this for 10 big breaths. 10 big breaths. And I say that because it's real easy to do about 2 or 3 or count to 10 or 15, but we really want to hold it for longer and get into a deeper stretch here. Now, a couple of options you can do is you can have your foot up against the wall to help take the pressure off of the arms and do the same stretch in that situation. You can also hold on with your knee bent and holding on to right here. So just some other options. But Cheryl, yeah, that's another option. But
what you said.
My arms are longer than hers. Works for me, didn't work for her. So now I'm gonna say we're at about breath 10 here, and we're gonna go ahead and switch sides just so that you can see the difference. So we start with the right leg on the ground, left leg crosses at the knee, left ankle, pull the right leg back, and we're gonna hold for 10 big breaths, softening into the stretch. Now the piriformis muscle is deep in the buttocks. It's underneath the glute maximus, and it sits right on top of the sciatic nerve. But what it does when it contracts is it rotates your hip outward, and many people spend most of their time with that hip in a rotated outward position. So this is just a stretch to get into that piriformis muscle that gets really short and tight with most of us as we age and affects this hip arthritis that we're talking about. All right, take a break from there, Cheryl. Now the next one we're gonna do is an internal rotation stretch. And so I wanna have you bring your legs a little bit further apart like this. And what I want you to do is bring this knee towards this opposite ankle. Yeah, and you should feel the stretch. You may feel that in your piriformis. You may feel it into the front of your hip. Where do you feel that?
Over here.
Okay, all right. So that's your TFL, the tensor fasciae lata. Now what I'm gonna have her doing while she's doing the same big breaths there, 10 of them, is I'm gonna have you very gently telescope out into my hand. So you're kind of reaching very gently away, and then relax. And then very gently reach away and hold that for a moment and relax, or a breath we'll say. Exhale, reach out. So she's just giving me a little nudge, a little push, and we're creating a little more space in here. Good, and let's do another one of those. So with here, we can do 10 breaths and relax and go on into the other side. So here we can do 10 breaths holding that position, but after a couple of breaths, I want you to start thinking of that reach out. It's a telescope out through the femur. Yeah. And so that's just going to create a little more space in the hip joint. And again, what is arthritis? It's an inflammation of the joint space. So if we can create some separation, some space in there, it's going to only be helpful. And can you tell the difference between those two, Cheryl?
Drastically.
Yeah, which one is tighter?
This is tighter.
Left one is her tight one. She's kind of her left side is her chronic side. All right, and give me one more big push away, lengthening, lengthening, lengthening. In the gyrotonic world, we call this the fifth line, and relax. All right, so now let's bring the feet together, knees together. So we did a piriformis stretch. We're gonna call that the internal rotation stretch because we're going into internal rotation, but it really kind of stretched a muscle called the TFL. So here we're just gonna do a rotation stretch, both legs together. Now this is a lower trunk rotation. It's actually not a hip rotation. But as you rotate this way, it stretches all through up to the lower rib cage, excuse me. And then we're gonna go back and up and over to the other side. And we're gonna just kind of make this more of a movement stretch than just holding it for those 10 breaths. And then come up and over. And we're gonna do it back and forth 10 times. That's it. And why are we stretching the pelvis whenever this is about hip arthritis? Well, if we just focus on the hip, we're gonna miss a few things. So we're actually creating a little mobility at the lumbar spine here, the sacrum, and the hips as well. But the hips have less motion emphasized here than, say, the last stretch we just did. Now, can you tell the difference with going side to side with that one? And same, I didn't ask, but in the piriformis stretch, was it also tighter on this left side in the piriformis stretch, the first one?
Actually, my right piriformis.
All right, so here we go. That's a great, I'm glad that was their answer, because it was not the side that hurts, it was her opposite side that was tighter from compensating and just day-to-day life. Okay, so there's our 3 stretches. So that is 3 stretches. Now we're gonna go into 3 exercises. Now with the exercises, we're gonna use an ankle weight. Now I'm gonna put a 2-pound weight on her. See how hard this is or easy it is for her. And we're gonna go on the left leg because that's her weaker side. And what we're gonna now do, and with that being her weaker side, that's gonna be the side that she's gonna have a more chance of developing osteoarthritis in the long run. Now, what I want you to do, Cheryl, is lay on your side and face that way. We're gonna basically just flip and quarter turns here. Now, in that position, top leg is gonna be straight, bottom leg's gonna be bent, and we're gonna put that leg under your tiny bit. So from here, we're gonna think of a little space here in your back so that you're not compressed in your lower back, and you're gonna lift that left leg into the air. You're not going forward and you're not going back. And remember that little pistoning idea that we talked about a little while ago? You're gonna think of a little pistoning reach out of your heel. Now, if she's doing 10 of those, that's already 3. Stop at 10, Cheryl. She's got a 2-pound weight on her. This is a adjustable 5-pound weight. Right now it's set as 3 pounds, and these 3 pounds are in the weight constantly, but it also has 2 additional 1-pound weights that could be added to it to make it a 3 or 4 or a 5-pound weight. I love these types of ankle weights because it allows you to progress. And a 2-pound weight, is it heavier?
Yeah, it's heavy.
Yeah, it's a lot heavier than people think. And again, this is kind of a therapeutic exercise for a very specific muscle on the side of the hip abductors. Okay, now what I want you to do, Cheryl, is roll to your stomach. And as she rolls to her stomach, we're gonna do hip extension. So hip extension, you're gonna raise the hip, the leg in the air with the knee straight, contracting the abdominals. And we're gonna exhale as you lift. That's it. And we're gonna do 10 of these, and we're gonna really have you at home start doing sets of 10, 2 sets, 3 sets, building your way up to 3 sets of 10 over the next week or 2. And we're only gonna show you on one side today, but I would have you do these on both sides for symmetry and paying attention to how the 2 might be different and how they might feel different with strength. All right, now the last one we're gonna do, that's it. And now what I want you to do is take the bottom leg and keep it straight. And then take the top leg, and there's gonna be 2 options. The option she's in there, just lifting the bottom leg now. Yep, that's one way. Another way, let me just show you because I want you to do whichever one's a little harder for you. This is another option here, and then lifting the leg from there. Which one of those is a little harder for you?
This one.
All right, so let's do that one. Do this one, excuse me. That's it. So this is your adductor. So we went from the abductor to the extensor to now the adductor, which is the inner thigh. And the inner thigh is actually a big muscle, but it's usually weaker than the abductors. It's kind of interesting. Bigger muscle, but is typically weaker. So here we are, 2-pound weight, 10 reps. Start with a set of 10. Do 3 sets of 10 as you progress over the next week or 2, and do the strengthening exercises after the stretches, and we'll be back with another video real soon to show you the next round of exercises. So comment below and tell me what you learned from this video and what you can implement immediately. So now I want you to go to Amazon and download my book, Retrain the Brain to Solve Back Pain. Yes, it's a comprehensive book for back pain, but all of the exercises in it are great for hip osteoarthritis. And chapter 4 is the most important chapter in this book for anyone with hip arthritis. Live in Austin, Texas? Well, come try our Pilates Reformer classes or privates, or our Gyrotonic Tower classes or private sessions. They're great for those tight hips and weak hips. Be on the lookout for my next video in my hip osteoarthritis series.